Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome back. This is News and Views with me, Julie Ali. And our next guest is Haniefa Allee. She's from the Islamic Medical Association. And she's going to be talking to us about Muslim nurses' dress code. Assalamu alaikum to you, dear sister Haniefa Allee. Welcome to the program.
Walaikum salam. Jazakallah for having me. And assalamu alaikum to our listeners.
Lovely to have you on the show. We are going to be talking about the issue around, we understand that IMASA with the Cape Town Ulama Board and other Islamic bodies have requested exemptions for Muslims, Muslim nurses, after the recent issuing of the National Department of Health's National Nurses Uniform Policy Dress Code. So, what is the story here about Muslim nurses and their dress code? What is it that, what sort of accommodations need to be made for our Muslim sisters who enter the field of nursing?
Okay, we just have a problem in that every now and then this business of the headscarf that becomes a problem. We've had that previously, and I remember going to the KZN provincial department, and nurses were allowed to use the scarves thereafter. Right now, what makes it very difficult for us is the letter or the memo from Dr. S.S. Buthelezi says quite categorically that headscarves are not allowed while on duty. The moustache and beard must be neatly trimmed and should be aligned to mask fitness testing prescripts of occupational health. Now, we have a major problem. We have had our new constitution, and all religions could be practiced. And one of the most important aspects for us as Muslim nurses is that we are to be wearing loose-fitting clothes, unrevealing clothing, save the face, hands up to the wrists and feet from below the ankle. The hair must be covered with some form of covering. This represents minimal dress requirements for females. So we have a major problem that the memo categorically says that we've got to look at the circulars aligned to the South African Nursing Council regulations. Some of them are mentioned, that the uniform which distinguishes devices of different nurse categories must be obeyed. Now, we don't see anywhere where it says that you cannot wear a headscarf. So we are quite concerned about this, because this is our identity. This is our whole a human right. And we are now being told we are not to wear these scarves. And yet it goes on. But I am quite concerned that it might become my talking racially right now, which I really don't plan to do. And that is that wigs are allowed. Now, I cannot imagine the scarf being something that will spread cross-infection, because we wash our scarves every day. Yet our epaulets that we wear are not washed or cleaned every day. well, some of us would like to keep it clean, and the wigs and braids are allowed. And it says that it must fit the inside a theater cap. Now, our scarves. How does our scarf um, become a problem? I really don't
Exactly.
understand this.
Exactly, Sister Hanifa. As you were speaking and you spoke about braids and wigs, I was recently in hospital for for a short while, and there were a couple of nurses attending to me, and they were wearing wigs. And I mean, no one raised an eyebrow around that. And when you look at the hijab, Alhamdulillah, if anything, if anything at all, my belief is that it prevents any infections of strands of hair possibly falling on the patient's bed, on the patient's tray, or whatever the case may be. And going back, way back in the day, weren't nurses wearing some form of headgear for the very reason of preventing disease or hair, etc., falling around and spreading? So why now, this many years later, it seems as this is one of those Islamophobic rulings. The Western world is up in arms against Islam, and they just seem to have a huge issue of women, Muslim women, donning the hijab. I can't see how a piece of cloth on my head is offensive to anybody, and how that breaches any rule in any book across the world. If anything, allows me dignity. It keeps me neat and tidy. My hair is not all over the place, and very especially in terms of hygiene and spreading of diseases. Wearing a headscarf actually contains that, does it not? It's only recently that
Absolutely.
we've seen it is only recently that we've seen that nurses all around the world have stopped wearing headgear. But up until recently, we do know that nurses all around the world were donning some form of headgear as a form of preventing diseases, preventing germs, preventing their hairs falling all over the place. So this really does sound like Islamophobia, as far as I'm concerned.
Yeah. Julie, what I would like to say is headscarves hold immense cultural and religious significance for many individuals, serving as symbols of identity, modesty, and personal faith. And if this is going to be, prohibited by prohibiting headscarves, it could discourage females from taking on, Muslim females from taking on the nursing profession. There's so much else that is happening in this country that needs urgent attention. Now we go on to this. The old fashioned, there are some uh, places where nuns provide a service to patients, and they're allowed to wear their headgear. So, how come it becomes a major problem for us here in South Africa? So many countries around the world allow the scarf to be worn by um, nurses.
Okay.
You
Can I just stop? We need to go for an ad break, but let me also ask you about the response from the Department of Health. I hope that they have responded. And if they haven't, I'd like to know what would be IMASA's next step regarding this ridiculous situation. So please do stand by.
okay.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal South Africa's Breakfast Club aims to get a warm, hearty meal to underprivileged children so they can spend their day prospering in their schoolwork. Help feed a needy learner for only 5 Rand a day or 150 Rand a month. Or visit our website www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal South Africa. Small change, big difference.
For a long time, we've lived in a centralized world where institutions held the all-important data and confirmed all transactions. Those times are over. Welcome to Libertas Group, a blockchain developing company boasting an ecosystem that continually redefines the way we do business. Our blockchain is decentralized, making it immune to hacking or alteration, putting the power back in your hands with no middleman so you can focus on the growth of your business. Libertas, the simplest investment choice you'll make.
1 year ago, our lives were forever changed when we met the Syrian and Palestinian refugee children from Africa Muslims Agency's Amman School in Lebanon.
I love you, South Africa. I will miss you, South Africa. I'm so happy to see you all.
The One Child, One Dream Tour. Join AMA for a fundraising dinner and exhibition on the 9th of September at the Orient Islamic School Hall in Durban as we share the impact that your donations have made, taking these beautiful children one step closer to achieving their dreams. Get your tickets now. Contact 083-843-2562 or follow Amma on social media.
Online schooling? Why not? Kurtuba Online Academy is the leading global online Islamic school from grade R to matric, offering South African caps and international syllabus. And it doesn't stop there. We also offer online madrasa for every grade. For more information, visit www.kurtubaonline.co.za. Kurtuba Online Academy, the leading global online Islamic school.
Listen to something fresh. Listen to Salam Media.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome back. Our guest is Sister Haniefa Allee from IMASA. We're talking about the ridiculous, for want of a better word, the ridiculous issue around Muslim nurses' dress code in South Africa. And of course, we are up in arms with the health ministry regarding this situation. Haniefa B, welcome back. Undoubtedly, IMASA has and other ulama bodies have written very strongly about the situation as far as the health ministry is concerned. Have you had any response from them?
Actually, we wrote our letter from IMASA on the 13th of August, 2023. We have not received any feedback. Then on the 7th of August, the Jamaat al-Ulama sent its report, concern, and nothing's happened. But, empirical evidence and hygiene concerns is really not applied here. There is no substantial evidence to suggest that the headscarves, pose an increased risk of cross-contamination. And there is no contamination compared with not wearing headscarves as you have just mentioned now. And what is more important to me, as a nurse that served on the Nursing Council and the Nursing Association, which has now become the Democratic Nursing Organization, of which I am a member, our nation's constitution stands as a testament to our commitment to safeguarding the rights of all citizens, including the freedom of religious expression, and that's section 15 of the Bill of Rights. And it upholds the right for us to, all of us, to practice our own religion freely, unburdened with discrimination or undue restriction.
Okay, so Haniefa, can you tell us? We need to wrap up now. You haven't received any response from the Department of Health. How long are you going to wait out, and what's the next step going forward regarding this matter on the part of IMASA?
Well, I tell you what, it is on the program for our joint discussions at our convention on the 23rd and 24th of this month. Number one, the president has now decided to write to the Department of Health, and Jamaica Ulama will also do that, and many other religious bodies. We are going to write again, and thereafter we will consider our steps to take to give ourselves the freedom of practicing our religion. There was even a time where they don't allow long sleeves, and we as Muslims need to have our hands covered up to the wrist. And then the beards is another big problem. And our Muslim doctors and nurses, have it trimmed. And we don't have these long, great beards that cannot fit into masks and, all coverings that are necessary in the theater and so on. And even if it means wearing 2 or so masks, our men do that. So we have a major problem, Julie.
Sadly, I am of what I've heard about the nursing profession is there doesn't seem to be very many young people wanting to go into that profession. So there's that issue as well. And then added to it is the issue around lots of young Muslimas wanting to go into any profession for that matter, but they want to have the freedom of wearing their hijab. So this will be a deterrent for Muslimas who wanting to enter the nursing profession. They won't, because they're not going to obviously sacrifice their Muslim values on the whim of someone sitting in a boardroom thinking that a hijab, is not suitable in a medical environment. And where they come up with that, I end with this once again, saying that back in the day, nurses used to wear head coverings. And that was for the very reason that we're talking about, to prevent contamination, germs, their hairs falling around all over the place. I'm sure you remember it as well when you started nursing, that you wore a cap or a veil of some sort as part of your nursing uniform. So what's changed?
Absolutely. So what's strange now? And Section 15 of the Bill of Rights upholds this right for us. And we are just feeling very, very disadvantaged.
Well, undoubtedly, IMASA is going to put pressure, and obviously the ulama councils will put due pressure where needed, to do away with this ridiculous issuance by the health ministry regarding hijab, disregarding hijab for Muslim nurses. But undoubtedly, we'll be talking more about the situation sometime in the future. Shukran for your time and your insights, and salamu alaikum to you.
Walaikum salam to you and to our listeners. Jazakallah for this opportunity. Thank you.
That was Haniefa Allee, and she was talking to us about a very contentious issue. I'm steaming when I hear about stupidity by non-Muslims wanting to ban the headscarf because of some crazy notion they have in their heads that it is going to hinder the nurses or whoever it is from performing their duties 100%. Come on, guys, wake up and stop being such Islamophobes. The time is exactly 8:58. News and views on Salam Media. Standing by with the bulletin of the morning is our correspondent, and that is you, Zahi Jadwit. Please stay with us.